Have you ever found yourself pulling out strands of your hair when you're stressed, anxious, bored, or even deep in thought? What if I told you that for some people, this isn't just a habit, it's a recognized mental health condition called trichotillomania? Today, we're going to talk about what it is, why it happens, and how people can get help. Welcome back to Talk with Peter's Precious. My name is Precious, and on this channel, we have honest conversations about mental health. We talk about psychological disorders. We talk about emotional well being for individuals and even at large for our relationship and our families. We talk about the challenges many people experience but rarely talk about. And today's topic is an interesting one because it's called trichotillomania, also known as the hair pulling disorder. This condition affects people of different ages, different backgrounds, yet many individuals suffer in silence because they feel embarrassed, they feel ashamed, or even misunderstood. Now to the fun part of it. What is trichotillomania? Now, trichotillomania is a mental health disorder characterized by recurrent urge to pull out one's hair. The hair may be pulled from the scalp, the eyebrows, eyelashes, beard area, or even other parts of the body. Now, the person oftentimes tries to stop, but it finds it difficult to control this particular behavior. Over time, the hair pulling can lead to noticeable hair loss, emotional distress, and even problems in social or professional life. Let's talk about what it feels like. For many people, hair pulling is not random. Some people describe this feeling as like a built up tension, stress, anxiety, or even discomfort before they start pulling. Other people may not realize they're doing it until they notice the strand of their hair in their hand. After pulling, they may feel temporary relief, satisfaction, or even comfort. However, this relief is often followed by guilt, frustration, embarrassment, or even regret. Why does this happen? I'm asking myself the same question. Now, there's no single cause for trichotillomania, and researchers believe that several factors may contribute to it, including things like stress, including anxiety, emotional regulation difficulties, genetics, brain chemistry, even co-occurring conditions such as depression or obsessive compulsive disorder, which is also known as OCD. And for some people, hair pulling becomes a way of coping with uncomfortable emotions. And for other people, it happens automatically during activities such as studying. Maybe they're reading for an exam or a test. It could occur when they're like watching the television, driving, or even scrolling through social media, or if they even have like so much on their mind or thinking about something so deeply. What are the common signs and symptoms? Some common signs include things like repeated hair pulling, noticeable bald spots as a result of hair pulling, missing eyelashes or eyebrows, difficulty resisting the urge to pull, feeling of shame about the behavior, avoiding social situations because of hair loss. And one of the hardest parts of trichotillomania is that many people feel alone because they find it difficult to talk about it, and a lot of people do not really realize that it's an issue or a problem. They might just think to themselves like, why can't I stop this? What is wrong with me? If I talk about it, will people judge me if they find out? But it's important for us to understand that trichotillomania is not a sign of weakness. It's not a sign of lack of self-control. It is a recognized mental health condition, and people struggling with it deserve support, understanding, and treatment. Now, after giving a quick overview of what trichotillomania is, the next question that comes to mind is, can it be treated? And the answer to that question is yes, it can be treated. Many people benefit from things like therapy, CBT, cognitive behavior therapy, and habit reversal trainings. These approaches help individuals identify the triggers, recognize urges, and replace pulling behaviors with healthier coping strategies. And stress management, mindfulness, support groups, and treatment for underlying anxiety or depression can also be helpful. But the main thing you can do to help yourself is seek help outside, because there's so many resources out there, people willing to help, and so many solutions to this. So it is treatable. Please do seek help, or if you know somebody that knows somebody that is dealing with this. If you or someone you know is struggling with air pulling, please know that there's help available and recovery is possible. You are not strange, you're not weak, and you're certainly not alone. Mental health challenges oftentimes thrive in silence. People do not talk about it, but healing does not begin until we start talking about them. So, if you found this video helpful, share it to somebody that knows somebody that knows somebody, and just put it out there so people are familiar with trichotillomania and it becomes something talked about and people are able to seek help once it is needed. Quick take home question that can make people just to introspect and think about it real quickly. Have you ever noticed yourself developing a habit that when you're stressed, you notice yourself developing a habit when you're stressed, when you're anxious, or when you start to feel overwhelmed by something or anything? And what healthy coping strategies have helped you as a person? Also, don't forget, this is Talk with Precious, and where we take a little time to talk about your mental health and to just educate people on what is going on out there and things people are not familiar with. Don't forget to take a little time this week to talk about your mental health, and I will see you in the next video. Bye bye.